Hello, hi ma'am.
Namaste, how are you?
Yeah, I am fine, ma'am. So sorry for the delay. Got stuck with the patient.
No,
I'll just
no,
send an
no
invite.
issue.
Yeah, I'll
Okay,
just send an invite to Dr. Charan also. I'll just
all
see
right,
if he's
okay.
right.
Okay, can
One
you
second.
also check if the lighting is okay and if you can hear my voice? You want some changes, is that okay?
Yes, ma'am. I can hear your voice, ma'am. Yeah. One
All
second.
right, and the lighting is fine?
Yes, ma'am. Lighting is fine, ma'am. One
Okay,
second.
great.
I'm just checking Dr. Charan once, ma'am. One second.
Sure.
Till then, ma'am, you can introduce yourself, ma'am. I'll just coordinate with Dr. Charan in the meantime. So sorry, ma'am.
Okay, I studied law, but I became an educator by passion and found it as my calling ever since then. And here I am on the invitation.
No, no problem. Occupational hazards.
So, ma'am was just introducing herself. Please, ma'am, carry on. Then we'll start the
Yeah, so I
session.
am done with that. I mentioned my credentials and I mentioned that I'm looking forward to this exciting session today.
Yes. So I'm Dr. Preethi. I'm senior consultant pediatrician, and I'm very thankful to Dr. Charan and Usha ma'am to join us. Dr. Charan is a neuropsychiatrist at KIMS, and he has been doing a lot of work on mental health and helping out the youth. So great. And thank you, ma'am, so much for joining us. Before I
My
start
pleasure.
the session, ma'am, a burning question: are the board exams actually happening, or do they stand cancelled? What is the latest?
Well, I can only tell you the notification that we have received as of now. All
Okay, ma'am.
exams so far happening. It's in abeyance. The decision hasn't come in as yet. As of now, all schools have been forbidden across the country to call children to school under any pretext. So whether the
Okay.
board exams will take place or not is $1 million question, which I think only the government officials will be able to answer.
Okay, okay. So, ma'am, you have been in this field for so long. So, when do you think, ma'am, exam stress starts for children? From which grade does it really start? Like, right now, I have a nephew who's in fifth grade and my daughter is in second grade. Both of them are least bothered. Only one day, my nephew will be a little disheartened if he gets a B in maths, and everybody will say, "Oh, you didn't get an A." But that's it. So, at what age do you think the pressure starts building on children, ma'am, as per your experience?
I think it is very individual dependent. Okay, I have to
Okay.
tell you that I have 3 kids and I'm speaking from personal experience. Okay, the oldest of the lot, he couldn't care less. The second one, if she got stressed, she would start doodling. And this was true right from when she was very young. Okay, and the third one, the mere mention of a test, the mere mention of a assignment due, it bothers her. So I think it's very individual dependent, and a lot of it comes from the way we react. We as parents react to children when they say that they have an assignment or they have a test coming up. I think it's a combination of factors. Again, very individual driven.
Dr. Charan, your experience, do you get patients of younger age or only older children who are bothered with exam stress and anxiety?
Firstly, thank God I don't have children. So yeah, I think right now what we are seeing is older children coming with exam stress. I think for younger children, parents chose pandemic over exams. They're like, I want my kids safe. I don't really care for the exams or the results. You know, they finally prioritized not education but the health. But I think for older children, you know, because career is so almost there, you know, they're almost there where they can actually do well in their career. So I think it's definitely a primitive thing. So mostly older children is what I'm saying. Medical
I
students.
would like to I would like to add to what Dr. Charan has said. I think it starts grade 9 upwards, where children begin to feel pressurized. One, that there is this confusion. What is it that I'm going to do? How is it that I will cope with life after school? And what should I take up as a subject choice? I think it starts building from class 9. It peaks at probably class 10 during the board exam. And then, of course, 11 and 12 is an entirely different ballgame of stress.
So, what are the early signs of stress? Like some parents just think, okay, this is normal exam stress and we can ignore it. I am having an increase in children, adolescent children coming with headaches, stomach pains. Now, obviously, we can't just label it on exam stress, but that does contribute. Maybe part of it is gastritis or acidity, and part of it is a poor eyesight. But definitely, stress adds to these, problems. So, what are the pointers when it is not just your regular stress, and the parents should take extra precaution, Dr. Charan? Like, what are the red flags in your experience which should not be ignored by parents?
I think firstly, generally, the word exam itself creates stress.
Yeah.
Even at this age, if I have to do like a fellowship, I would be stressed, instead of me talking about how to reduce stress and everything. So the word exam is associated with a lot of stress. That's mostly because of the grading system is what I feel, because, somehow your entire existence at a particular age is equated to the number of marks you get, or where you stand in the class in par with other kids, or with your cousins, or with your own sibling, or with your neighbors, or with your friends' kids, etc. I think firstly we have to separate the word exam from stress. I mean, it's a long way for the modern education to happen, but I see a lot of schools are doing this already. They're not. Mrs. Usha can tell us about that, where it was not like olden days where there is class topper and then second and third, and then there is somebody who failed. But you are, I think, grading kids in a very different way. I think
Absolutely.
yeah.
Yeah, you're
I
right,
think,
right about that. I think, yes, the fear of the word exam itself causes anxiety in children. However, as schools, as progressive schools, like the Sri Ram Universal School, we are moving away from where we are categorizing children. So we are looking at assessments, not exams, but assessments as a means of feedback to the teacher to know what is the concept that she needs to brush up again, what is the concept that she needs to touch again, where is it that the children have found it difficult to cope with what has been taught, how can she make it better for the child. So we are using it as a feedback mechanism for the children rather than as a way of slotting children into particular grades or ranks or categories. Therefore, I think at the Sri Ram schools for the past n number of years, we've never had ranks. We do not believe in that, and that's true for most progressive schools. So that, I think, helps children to understand that exams are not something to be pressurized about. Also, in the run-up to the assessments, we also do sessions with the children where we talk to them about how to cope with the pressure of exams, what is it they can do in order to better themselves, and how they should ask for help. What are the techniques or the things they need to do in order to prepare themselves so that they do not get anxious about it. And as a school, wherever we find that children are becoming anxious, we connect with the child on a one-on-one basis, and we also talk to the parents to ensure that we are able to keep it at a manageable level. We are able to address it, and it's a red flag for us to ensure that to check whether the child is comfortable or not. So we are definitely doing that.
yeah, that's good. But also, I think parents need to stop talking to kids in a very different way. Like, okay, you know what? No more watching TV. No more living a life. Exams are coming close by. So don't create the panic in the kids. Like, slowly prep them towards the exams and be with them. You have to give time for the kids. Because every kid is very different. Some might not need any assistance. They're very, very well on their own. Some might need assistance. Some might need maybe a group study. So understand what your kid is comfortable. Is your kid comfortable you teaching him or her? Is your kid comfortable you probably setting up a study group for them of somebody of the equal capability or someone who is better than you academically? You have to understand your kid and you go accordingly. I think moderate amount of stress is actually good for exams. So it keeps you on the toes and you actually work hard to your best capacity and give it your best shot. But too little anxiety or too much anxiety is a spoiler here. It's going to ruin everything. So what are the symptoms? Coming back to the question, are first thing, I'm sure all three of us must have faced it. I'm speaking for all three of us, right?
Yeah.
First is, chest tightness or racing heartbeat, or just feeling restless. You don't feel settled or relaxed. Your muscles feel little tensed. Because of that, you have multiple body pains, especially headache, with added lack of sleep that can worsen everything. Lack of sleep can be voluntary or involuntary. Some of us, we are last minute heroes, right? We try to cram up everything and study in the last minute. At least that's what doctors do, most of us, because our work schedules are very, very different. So lack of sleep is another main reason why you'll have anxiety. People who do a lot of fasting, hypoglycemia can trigger anxiety. Dehydration, you don't drink water. Some of them just take sips of water. Some of them don't drink water at all. Brain needs, I tell all my students, okay, brain needs three things, First is water, oxygen, and sugar. Sugar, I think, like any kind of food that gets converted into sugar. You have to provide all these three for the brain to actually focus or convert the memory into a long-term memory, so you can recall and perform well in the exams. So all this is what you see. Some of us experience sweating, blurring of vision, giddiness. We feel like we're going to throw up when you hear this word exams. All this can occur. These are some of the symptoms of exam stress.
To add to what Dr. Charan said, I remember reading a quote recently. It said, this was true for armies, it said that if you sweat during peace, you will not bleed during war. So in order to ensure that you're not stressed when you are under pressure, it's important that we prepare for it right from the beginning. And this is the advice that's true for everything for us in life. Whether we are talking about fitness goals, or we are talking about exam prep, or we are talking about career, or we are talking about relationship. As long as we are consistent and are able to maintain a balance, both as parents and as students, and we create a consistent or a regular routine, I think we will be able to tackle anxiety and stress, especially during the exam.
So, ma'am, I'd like to share. My father was very strict about certain things. So, in our house, be it any exam, you had to be in bed by 10 o'clock and you had to, complete 8 hours of sleep. We were not allowed to stay awake at night. And in the morning, we were not allowed to open the book. So, I used to read newspapers before the exams. And actually, I realized I was one of the least stressed even during MBBS and MD. So that really prepared me in the long run also. Now, I don't know if that works for all kids, but it worked for me and my brother. And my father was like really particular. You have to get 8 hours of sleep. You said, I don't care if you have left your portion, just do it. So, ma'am, do you also recommend this kind of studying, or is it okay to stay awake the whole night? And your take, because
I think all-nighters work only in movies. It doesn't work in real life. I know that those who have been in hostels or those who have gone for higher studies, maybe they will disagree with me. But I strongly feel that staying up all night, studying at the last minute only leads to anxiety. Yes, there is something called pulling it at the last mile, putting in the effort, converting at the last mile. But that last mile can't be the last minute. It can't be you looking at your books just before you're entering the exam hall. That is not a good technique, and that is not going to ever help you in life. Maybe one-off, you may be able to crack it or ace it even, but that is not a good practice at all. And I don't think it works. It has never worked for me. And I, like your father, I do try to ensure that my kids also get a good night's sleep before the exam. And I recommend to all my students, don't touch your books before your exam. In fact, when you enter the examination hall or just waiting outside it, don't talk to your friends about what is it they have studied. Don't clarify your last minute doubts, because it only ensures that you panic and doesn't help in any other way.
Yes, ma'am. So, ma'am, because what we are seeing now, especially, in children, I'm shocked. I got a child some days back and he was having headache. So he is on the screen from morning till night. So he's having school, then he's having coachings, then he's doing these bijus. These are like new things to me. And I was like, you will have a headache. You are not off the screen at all. So I told the parents, let him go for a walk. And I would like to reinforce to all the parents listening, please don't ignore their diet and their exercise. At least half an hour of walk, I'm sure, or yoga or dance or whatever, cycling they can take out. I'm sure it's not so pressurizing. Another thing about diet also I like to mention, when during exam time, give them more light food. Like rather than, a lot of children tend to take a lot of junk food. And somebody asked me the diet for exam. So there is no particular diet, but just don't give them very high fat food or high carbohydrate food. If they're hungry, you can maybe give them dry roasted, say nuts or makhane or something simple. And lots of water, like Dr. Charan rightly said, especially in the summers, maybe some coconut water, buttermilk, that works a lot. And screen-free intervals should be there. I really don't know, ma'am, what is this with this online coaching and Byju's? Are textbooks no longer good enough for study? I'm just asking. I'm like, my daughter is in second, just moved to third, so don't.
But I would like to ask you a counter question. Are we as parents being overambitious? Did we need it? Did we need so many coaching classes? Did we need to be online all the time? Was there a need for us to go from class A to class B to class C? There was no need. So there is the mantra that we lived by, and that is what all of us should live by, is balance. We need to find a balance with what is right for us. What was right earlier continues to be right today also. And we need to strike a balance between screen time, between number of classes, between coaching classes, and we have to ensure that our kids go out and are physically active. They have had a break from the virtual world. We can't help it. The fact is that school is online. That is the reality of our life. But what everything else beyond that, can we find a way to restructure it? I have to tell you that my parents have moved in with me recently, and my father insists that we play a game of carom every night. He says, so I get to talk to you. And none of you is looking at devices. So we are playing carom, or we are playing carom board, or we are playing card games. Yeah, it is something that helps us to bond, and we laugh out loud, and it's great fun. But again, as an 80-year-old, he's setting guidelines for me. I think all of us need to ensure that we are putting structures and systems in place to ensure that children are not hooked to devices. I think parenting never stops, and we have to find that balance.
Yes. Dr. Charan, this kind of exposure to screen, like this is for studies. So parents feel this is not like, this is mandatory, you really can't avoid it. Does this kind of exposure to screen also have a harmful effect on their mental health? Like we know for sure, otherwise watching too much of screen.
You seem to be stuck for me. Yeah.
Yeah, no, I'm back, yeah.
Oh, yeah, for sure. I mean, I'm telling all the patients who come to me to just turn off their notifications of social media mainly, because it's very distracting. It does mess with your head. It does affect you. You tend to compare. See, comparison is what drives us to insanity, is what I believe in. We always compare, with somebody or other. Either somebody puts a comparison on us or we compare. For example, I did very well studying last minute. So a couple of my friends who used to study from the beginning, they thought, oh, he's scoring decent, so why not, like, we also do what he does, and it didn't really work well for them. Same way, when I had exams, I was still going out, like meeting a couple of friends, just relaxing and coming back. Probably I post a picture on my story, right? Somebody who is struggling and trying to, get the concepts right and sees my story, and they would be disappointed. They'll start believing that this didn't happen. I'm giving an example. They would start believing that maybe I'm dumb, maybe I'm not intelligent like this particular person who is balancing everything. Maybe I'm a failure. So you're already setting yourself up for a failure. So it's better to turn off all the notifications. Or, for example, before this talk, I was actually Googling what are the tips for studying better. It's not really my area of expertise, right? Yeah. So I was just trying to brush a little bit, like, what are are there any new techniques, or how is it? I saw n number of blogs. There's just way too much information out there. What I feel is, instead of children going and reading the blogs, it's better them understanding what works for them. I always tell, I'm not going to tell you what should work for you. You figure out what is it that's going to work for you to relax. You have to take study breaks in between every 45 minutes, because our human brain of a particular age can only focus for 25 minutes maximum if you're fantastic, not beyond that. You studying for 6 hours back to back, or even 1 hour back to back, it's not going to register in your brain. You're just going to read it. You can't recall it later. So I tell everybody, take breaks every 25 minutes. Break shouldn't be onto your phone. What do we do? From the book, we go to phone, because that's the easiest way to just pass time. Instead, go take a flight of stairs, stretch yourself, go make a little bit of salad, or just cut a fruit and eat it. Just enjoy the food that you're eating, the light snack, whatever you're eating. Focus on completely something else. What we do, we call our friend and we ask, how much have you finished? I didn't even do like 1/4 of what I'm supposed to do.
Yeah.
Right? Just know what causes anxiety. For example, I'm a competitive person. So if I ask my friend, how much have you finished? If they said that they finished more than me, that would give me a positive boost to study better. But for someone else, maybe it works, it flips backwards. So if it's affecting you as a child, you have to understand. Maybe younger children won't understand, but adolescent would understand that, okay, you know what, I don't want to do it. Or I don't want to call this particular person who is going to stress me out. Or I don't want to talk to this particular parent who might stress me out. You, as a person, have to figure out, as a child, have to figure out like what works or what doesn't. I think that's what I thought. Did I answer your question? Did I derail? I usually derail.
Yeah. No. Correct. No, this online tuitions and online apps, I really find it a bit disturbing. We have like gone into a completely virtual world. So I think a break is necessary. Now, how that break works, that's entirely up to the parents and the child. Ma'am, your predictions on that?
All the
Yeah,
kids are playing Ludo on the phone. Why don't you just play a board game instead? With like you're saying, you play caroms, right? Like Usha is saying, like they all play caroms and they bond together. So do that instead of just being in your own room and
while I said that, but I also have to tell you, it's easier said than done. Okay, it's so convenient that I can catch up with my phone. I can catch up with what my friends are doing, what my peers are doing. I can also check that last minute email that has just popped in. I know there is work stress. As parents, we find it difficult to switch off from mobile. So when we are not setting an example for our children, I think they find it very easy. They emulate us. Whatever we do, they are copying us. Therefore, if we don't walk the talk, I don't think it is going to happen. So as parents, I think a lot of discipline is required in the way we interact with our children at home, because they are continuously monitoring us, they are continuously observing us, and children start observing us at a very, very young age. We are working non-stop. We don't take those 25-minute breaks. How can we prescribe it for our children? Yes, all of us are working from home. Most of us are working from home now. And when we don't take those breaks and we prescribe it for our children, do you think they're going to follow it? I don't think so. They know, and they will, if they have the courage, they will turn around and tell you, but hey, you don't do it. So I think as parents, it's very important for us to walk the talk, set the right example, and engage with our children, talk to them, have conversation around what are good habits. And it can't be in your face conversation where you are saying that these are the 5 things that need to be done. That's not how it works. I don't think it ever worked. Even when I was a kid, it did not work. I don't think it will work today. Our children require us to engage in a dialogue, and the dialogue has to be in a non-threatening environment where we engage with them without making them feel threatened. I think that will enable us to ensure that children don't feel very anxious, and that they take us and our words very seriously. So if I'm telling my kid, have a healthy snack, but I'm not taking it, my kid is never going to do it. Yeah. And if I'm not drinking water regularly, my kid also gets the message, oh, she's just saying, she's not meaning it. So I think it's very, very important that as parents, we set the right example.
And ma'am, what do you feel is this exam stress and the school stress more with online classes, or was it more with the traditional schooling system when you go to school? Because you are dealing with kids every day. So what do you feel, ma'am? I think the connection is lost. In the meantime, I'll answer one question. Somebody asked me foods to support immunity, memory. Per
Memory.
se, there is no such thing like that, memory boosting foods. But yes, there is something, they omega-3 and DHA, which they say is good for brain. So you can give your child a handful of almonds every day, walnuts every day. Flax seeds are very good in DHAs. Omega-3, so you can just add a pinch of it in their food. If you're making some salad, you can add in that, or on top of any dosa or omelette, that can be done. Otherwise, as I said, just give them light food, not very heavy food. A lot of children are gaining a lot of weight. Obesity is another epidemic, I think, waiting to happen. And in exam time, that should not be an excuse. Just let them eat what they want. I mean, just watch what they are eating. And unnecessary weight gain is not easy to lose, even for children. And childhood obesity does lead to adult obesity. Ma'am, can you hear me now? No, I think the connection is still poor.
Even nuts are great exam day snacks also. You can just carry them in a
Yes,
small box and you can munch
yes,
like in between. Yeah.
yes. Ma'am, could you get my earlier question? Stress levels on online versus traditional school. Could you get that question, ma'am?
I didn't get that. Can you repeat the question, please?
Yes, ma'am. Ma'am, as an educator, because you deal with kids day in and day out, do you feel the stress levels are more with regular school or now with this online school? For the higher classes, what do you feel, ma'am? Is this causing more stress
I
or less stress?
I think it's somewhere in the middle. Children are missing out on connecting with their friends, which was a big stress buster. They are missing out on the conversations that were happening in between the classes, and also sometimes during the classes, because they would sneak in a wink here, a giggle here, a smirk there, which added pleasure to the classroom. It made going into the class worthwhile. You know, while we are teaching many things, children are also doing all these things. So it's a classroom is a place which is very alive. Okay. Now that we are doing classrooms online, that the feeling of liveliness, the feeling of connectedness with their peers, I think that has been compromised, and that is adding to the stress. Of course, there is the stress of watching screen all the time. Also, as a teacher, if I am presenting something on my screen, I can't see the students. So there could be this child who's raising his hand all the time and saying, ma'am, 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 but I can't see the child. And the child could feel that ma'am has not looked at me. She has ignored me. While it's not the teacher's intention. So I think a lot of this kind of gap that emerges because of the fact that we are working in the online world is adding to the stress. And what is very important, I think, as schools, we need to ensure that our teachers have enough connect time with the children so that they are able to talk to them, understand their perspective, also gauge how the child is feeling in the classroom. Also, probably carve out a time where the children can connect with each other in the online world, because that's our reality, so that they don't miss out and so that they are not connected. Did you get that? I said we have to create time in order to ensure that children
Yes.
have connect time with each other and also with the teacher to reduce the stress that is occurring due to online classes.
Yes, so Dr. Charan, I would like your opinion on this social gap which has come, especially children who are single kids and who are just stuck at home and just studying. How can they stay connected? Any suggestions besides your Instagram and Facebook? I mean, what should they do? Any suggestions from your end?
I think parents should, like I said before, parents should set up a study group. Anything, even two can be a group, right?
Okay.
And two of them don't have to be in the same class as well. They can be in the different classes also. They can be studying different subjects altogether. It creates, for example, in school, we studied better in study hours because we're seeing a lot of people studying. So we collectively, we humans, we like Usha ji said, like, we mock people or we imprint on people. It doesn't have to be parents. It can be people just next to me, what they're doing. I learn what to do or what not to do by seeing them based on my opinion of what's good or what's bad. Same way, if you can set up a small study group of 2 to 3 kids, same class, fantastic. Not same class, that's also okay. They can all study together. Also, if you have any online material for them to study, it's better to take printouts of them and maybe sit and read in a traditional, because your hand-eye coordination, your muscle memory, all of that is better. I'm sure Dr. Preethi agrees with me. It's better when you study in a traditional network way of just writing things or reading things. What happens when it's on screen? It doesn't. It's not using all your skills, all your motor skills or cognitive skills, etc. So it might not last long. So there is visual memory also. The things that you write in your own handwriting, you remember better. For example, like some of the questions which I forgot the concept, I remember suddenly like a photographic memory. What did I write there? The flow chart, which didn't happen when I looked at a textbook, which is already very crammed up. Didn't make sense to me. So I think you can print out the material, set a small study group, make the environment very lively. You enforce they take study breaks in between. Ask all of them to go and play maybe table tennis for 20 minutes, which 20 minutes is barely anything. Or just go cycle 4 leaps and come back or something like that. You enforce, and more than enforcing, you can also do it along with them. So they'll feel like exams are just part of education system. It's not something that judges your capability. That fear will go down. So you'll do well mostly.
So every year, unfortunately, we do hear kids go trying to commit suicide, or some actually do it, and some may be going into severe depression, which we don't come to know of. I mean, I'll ask ma'am also, ma'am, in your long career, how many such cases have you seen, or you feel if parents and the teachers give the right guidance, it is totally avoidable? Have you come across any student? I mean, of course, I don't want the
Yes.
details, but just how can parents identify when the child is going into that depression drive, or totally going off cliff?
So I did encounter a few such students. They were students who were appearing for the board exams. So that situation exasperated, it added to their stress levels. And we were able to identify because we could notice, and because we are also in the physical world, not in the virtual world, we could notice that the
Yeah.
child was very withdrawn, that he was not connecting, the child was not making eye contact, and he or she seemed to be avoiding conversations. So this normally chirpy kid who would definitely have a comment to make about what was happening in the classroom suddenly became very, very withdrawn. And since we noticed this, we then connected with the peers who also mentioned a few of their observations. And since we had alerted the peers, they came back to us to say, "Ma'am, I don't think something is working well with so and so. Can you check that out?" And then we immediately connected. We put the child onto the school counselor. We got the school counselor to monitor the child. We also tried to connect with the child. In one particular case, there had been a tragedy in the family, and the child was still trying to cope with that. Therefore, we roped in the mother to help us so that we were able to reach out to the children. We also got the child to connect to her favorite teacher. Okay, the child was in class 9, but her favorite teacher was a teacher who taught her in class 6. So we made those connections, but we were all able to do that because we could observe the child very, very carefully in the physical world. Even now, in the online world, we have teachers who are connecting with children, trying to figure out in case something is amiss. If the child was normally someone who would answer a lot in the classroom but has suddenly become quiet, we are picking up the phone to make that call to understand, hey, is something amiss? Can I help you? I'm missing you in the classroom. Trying to make personal connections so that we understand where things are not working well. So that effort is, I think, and I say this to our teachers across the globe, that they are making this effort to connect with children. However, despite all this, yes, we do miss out on a few cases. That is can't be helped. Unfortunate, but that has
Yeah.
happened.
And Dr. Char, in your experience, you get some patients who've tried something drastic or who have really gone into severe depression. Have you encountered such cases, and what could be done by parents? Because now parents are more with the kids. So ma'am has spoken from the point of view of teachers. What is your take on that?
Yeah, I encountered with a lot of people because in the whole concept of the word failure is it's a very big thing. I think people make the word failure as a very big thing than actually what it means. It means nothing. You either passed or failed. So you have to again do it again all over to pass. So people think failure is such a big concept. Before this, Dr. Preethi, I would like to give a small advice to Ushaji because you're the educator, right? So my one concern is that a lot of kids that adolescents, when they come to me, when I ask them, why are you penting up all these problems? Why didn't you see a doctor or a therapist before? Don't you have a school counselor? Because I'm sure like all the progressive schools have counselors. They said that most of them said this, right? I'm not comfortable going to somebody in the school, in the premises of the school, because they feel like confidentiality could be a problem. Because these kids are probably facing problems at the home between a strained relationship between their parents, or let's just say mother and the in-law, or father and someone else, or it could be a father's alcohol problem. There could be infidelity in the family. Kids are very smart these days than what they were earlier in terms of social knowledge. They know a lot of, they're exposed to a lot of things, so they know all this. Or it could be somebody undergoing an abuse, physical, verbal,
Yeah.
sexual, any kind of form. So none of these kids were comfortable going to somebody in the school. Probably I always wanted to talk to some of the educators to tell that probably they can branch out to people they know where they can send the kids from school. So they can have they can have no confidentiality problems. They can actually open up and say things. In school, I mean, we didn't have any counselors back in the day.
Yes.
I mean, I'm sure like Dr. Preethi agrees with that.
Yes.
So our friends or our favorite teachers were our go-to people. But even with them, we couldn't say a lot of things. There's something happening back in the family. So there was no one that you can talk to. So I'm glad you guys are providing somebody, but I think sourcing out is a good option, I feel, because most of the kids said they were not comfortable.
Okay.
Yeah, I
This
think
is a
especially
point
for
that we just.
adolescents that may be an issue because there's a lot of peer pressure. I think younger kids won't mind so much when you probably send them for some behavioral issues. But very good point, Dr. Charan. Even I agree because especially I feel I don't know so much, but girls especially are very very conscious of their image. So yes, that's a good point. Yeah, ma'am, your
Uh,
suggestions. Yeah.
I would like to share that what we have done at the Sri Ram schools is we have kept the located the counselor's office in such a place that it is not obvious to other children that the child has gone there. Also, the counselor works in tandem with the academic coordinator and the teachers. So if a child is stepping out of a classroom, nobody else knows. Only the counselor knows, and the counselor keeps the others in the loop to say the child is with me. And the counselor ensures that she informs the child that it is confidential, that what she has shared with the child, what the child has shared is not revealed to others unless until it's something that requires immediate attention or urgent action. Even then, it is the principal who is the first port of call for the counselor. She will first connect with the principal to say, hey, this needs an urgent attention, this needs urgent action. Otherwise, confidentiality is maintained. And at least in our schools, my experience has been, even with my own kids, I've seen that they have begun to approach the school counselor for help because they realize that it is a safe space. So we do ensure that our counselors are seen around the school so that they are not strangers to the children. But again, the fact that somebody is going to them, that is kept very quiet so that children don't feel intimidated or feel that others will make fun of them. But that's a very good point that you have made, Dr. Chan. We will definitely keep this in mind.
Yeah, one more small tip. Sorry, I'm derailing.
Sure,
But
sure,
one more
sure.
small
Please.
tip is rather than waiting for kids to come to you, probably the therapist there can do a mental health screen. They can call in like 5 to 10 people. So when you normalize it, so kids when they're already in your room, they would know that, oh, it's a safe space. Because from outside, oh, how does it feel to go to a therapist? Or, like, would they judge me? Or are they very weird people? And these kind of questions are there, because of social media and how movies portray. So you can do a mental health a week or mental health month where you are actually posting 5 kids per day, where they're gonna go 30 minutes and talk to the therapist. So therapists can actually take down some of the names that they think are troubled for whatever reason, and you can again assign them in the further days. That I think that should work very, very well. Just like your eye health camps or pediatric camps, etc. Yeah.
Okay, I would also like to tell you that we have something called mentoring sessions on a weekly basis, which is like a circle time with the teacher. And these modules are designed by our counselors. So they design the module or what needs to be discussed depending on what is topical. And we also have our counselors walk in along with the class teachers to be a part of the session. So they get a hang of what is happening in the classroom, just so that they are seen in the classroom, and also that they have a finger on the pulse of what is happening. But yes, again, very good. We will definitely look at how we can weave this into our curriculum.
Yeah, yeah. Thank you.
Now, tips for parents, Dr. Charan. So this is for the school. How can parents be like? When should they really reach a counselor? Because honestly, little bit headache, little bit child is upset or moody during exams. That's very common. So when should a parent approach maybe a psychologist or a psychiatrist? What are the red flags the parents should watch out for?
Mostly these are behavioral symptoms because we discussed the physical symptoms before.
Yes.
Like Usha just said, if somebody is suddenly withdrawn. So problem is with introverted kids. So you can never tell if they're under stress or not. They would look, we'll be like, oh, that's how the kid is. See if their school performance is dropping in terms of sports or extracurricular or academic activities, if it's dropping. See if they're hanging out with older children. They're not preferring to hang out with people of their age. See if they're receiving a lot of complaints from school, because depression and anxiety doesn't have to be just feeling bad or just sitting and crying. It can be you self-destroying yourself. Self-destroying also. They tend to smoke, they tend to drink, they tend to probably engage in like unprotected sexual activities or gang activities. They would like to break the law because that gives a high for adolescent kids. All this you have to observe for behavioral changes. If you're seeing a lot of mood swings, if you're seeing somebody being cranky for no reason, because kids tend to mix up experiences. They don't. They can't call spade a spade. They tend to just put it in their head, and suddenly they'll burst out saying like horrible parent or whatever, right? So I think you just have to keep observing for their behavioral changes. Also, I think now we are mocking West a lot. So adolescence means troublesome period. Back in the day, I think me as an adolescent, if I said something, my father would have slapped on my face and asked me to just shut.
Yeah, that's true.
These days,
But yeah.
adolescents are being very difficult to deal with also because they're thinking that is normal. Being irritable on your parents and all this is normal. So you have to see if they're just doing it for the heck of it or if they're actually troubled. So watch out for their behavior, and you need to have time to watch out for the behavior, both the parents, not one parent. You have to play a good cop, bad cop. Husband and wife.
Dr. Charan, like since I don't know if some kids will be watching this, or maybe just parents can pass on this information. Now I know adolescent kids are very, why are you checking my laptop and why are you checking my phone? Should parents keep a tab on the social media activity of kids? Or should they respect them? And also, is there any website or any place where, if supposing I am a teenager and I am feeling depressed, but I am not comfortable telling this to my parents, I feel they may not understand me. So, is there some website, some genuine people who are available on the net to help these kids out? Because you will be knowing those. So, if you can just share on the group here. And do you have any idea, Dr. Charan?
In India, there are a lot of NGOs. I think.
Okay.
Right now, I'm not able to think on top of my head.
There is an NGO called Snehi. Snehi, it's a Delhi-based NGO which deals with children who are facing issues, especially anxiety-related issues. So they run a helpline, and I'm sure there are many city-specific helplines that are being run in order for children to connect with them. And as schools, we need to be popularizing those helplines, make it available, know that these are safe, and that should be publicized. I think that's important. But again, going back to the point that Dr. Charan made, as parents and as educators, we have to tune into the pulse of the children. We have to watch them, we have to engage with them. That is the basic point. If we miss that, then there is a problem. Also, one more thing that I speak this from personal experience, that as a parent, I should also be okay if my child says, no, I can't tell you something, I have to talk to an outsider, I have to talk to a counselor. I know when I heard this the first time, I jumped, I yelled, but that was absolutely wrong. I should have been more receptive and told the child, it's okay, why don't you connect? Why don't you find out how can I help? And then found another opportunity to connect with the child instead of reacting and ranting and raving. Yeah, that was a mistake I made, but today maybe I know better. So I would definitely advise all parents to keep an open mind when the child says, I can't confide in you, I can't talk to you, I need to re-approach someone else. It breaks your heart. You feel that, oh, what do you say, Dr. Charan, to that, and Dr. Preethi?
Yeah, before that, sorry, so I remembered some of the names. One is Parivartan. I even wrote them on the comments section. Parivartan is one Bangalore based. Swabhava, again, Bangalore, because I studied from Karnataka. I don't know too much here. Sahaya is again something from Karnataka, if I'm not wrong. So Swabhava, Sahaya, and Parivartan. I think those three are doing pretty good job. Yeah, I mean, kids can reach out to any of these NGOs.
Okay. Yeah, I agree. I mean, parents are the mainstay, and especially in COVID times, they are there at home. I mean, there are not enough teachers, don't have enough time with the children. There are no counselors around, so parents have to play all in one, all the hats they have to don. And with the adolescent kids, there's always this issue of, I was asking about that. Should parents check their social media accounts? I know they don't like it, but what if there is some social media bullying happening? And that is a real thing. Is it? I mean, I know a lot of kids are ridiculed on social media by their friends, and that leads to a low self-esteem, and that may add to all the stress in their life. So, should we? I mean, trust them and let it go? And how can we identify that?
No, I think till a particular age, it's good to keep a parental control to what they're accessing, because it's a whole world out there which is very dark that they can expose too early, right? I think you'll have to, instead of kids not liking it, but you have to tell them, you shouldn't do it like an arbitrary ban. Instead of that, you can just have a conversation with them saying that so-and-so has happened and so-and-so got into trouble. You can give personal examples of how probably you got into trouble even at this age because of social media. I'm sure we all had bad experience. We all had people writing snarky comments and things like that. So you can tell them that, I don't want you to get affected. I'm trying to protect you. You can have a healthy discussion saying that when you think you're feeling suffocated, when you think you're being way too controlled or dominating by me, please let me know. But you have to, it's again how you speak, right? You have to tell them, you cannot blame me because I'm discussing this with you. Sorry. Patient's calls have started.
Yeah, okay. I think most of the questions are done. Somebody is asking how to avoid screen time to child. Alekia, that this is more about older kids giving exams and all the stress they are facing. That discussion maybe we'll take up sometime later. Ma'am, your closing thoughts and message to parents and children.
Okay, I would like to definitely say that when you want to have a conversation with your child, don't sit at the dining table and start giving the lecture. Maybe go on a long drive where the agenda is not the conversation, but the agenda is the drive. And as a part of the drive, I think have that conversation, because the child knows your attention is on driving and not on the child, and then pick up that opportunity to connect with the child, talk, and probably sneak these kind of conversations into it. So it's very important to have non-threatening conversations with the children so that you're able to connect and engage with it. That is one. Second, my closing remarks would be probably a summation of what all we have discussed. One, that as parents and as educators, we need to be very consistent. We need to ensure that our children have sound sleep habits. We need to monitor that. We need to ensure that the Wi-Fi access is not available at night. Switch off. We are the ones who are supplying data, right? We can find a way to plug that off. Therefore, let's not buy those jumbo packs which children can access, use it to access online. Then, as parents, we have to walk the talk. We should not be hooked to screens while requesting them not to. One point that I picked up from Dr. Charan was to turn off notifications, both as parents and as children, because that will definitely help. Also remember that too much information is not good. Like he pointed out, there are umpteen sites telling us how we should be managing our time, how to reduce stress, how to reduce anxiety, how to ace exams. There is no need. Let's follow simple tips. Let's follow one guru. And the guru can be the parent, can be the teacher, can be an adult you trust, but let's not overload ourselves with information. And also remember that what works for A may not work for B, may not work for C. Therefore, find out what works for each one of us and what works for our child. Let's not make any comparisons. And I think if we are able to do all this, we should be in a safe. Right?
Thank you so much, ma'am. Very well summarized, ma'am. Dr. Charan, anything you would like to add? I think ma'am covered everything so beautifully.
Yeah, she
She's such
summarized it
an
all. Made my
excellent
job very
educator. I think you and I also learned so much from her. Actually,
Yeah.
I have this habit on the dinner table. I will tell my daughter, okay, now this is not what we should do. So, okay, that was me. I'll change that. Now she's just 7. I have time to change that. Okay.
But
Thank you so
Dr.
much. Thank you.
Having
Yes.
said that, educator and being a parent, they are two different ballgames. What I say may not always be able to practice it. And I think as humans, we are aware that we do have flaws and we are aware of and mindful of our actions. As adults, I think we'd be setting a very good example for the children. I think that is something that we need to remember in our life.
Yeah, my last thought is before we end, if is there any kid parent are average at studies, it's okay. It doesn't matter. Just try to be happy and try to give it your best. Your best can be average. That's okay, but that's your best. So give it your best shot and don't equate your self-confidence to the scores that you're having. But I'm not encouraging you to be average. If you can be excellent, be excellent. But if you're capable to be average, that's okay too, because everybody has different brain. Everybody has different wiring. How we work. So yeah, try to be happy and please reach out to your parents or your counselors, your teachers, your educators. There are a lot of people that can help you. You need to just be open to help. Help is not that difficult to find in today's generation.
Yes, I absolutely agree to that. And these days we have so many avenues besides studies that our time really the options were less. So really, even if you don't do well in an exam, it's not the end of the world. You have lots and lots of options. And even if your parents are strict, if they are strict, most of the parents these days are quite okay with the kids. But even if they are strict, at the end of the day, they are your parents. So if you're being bullied, you're feeling overwhelmed with exams, please reach out to them, because right now I know teachers are not so easy to reach out to, and no stress. Okay. Best of luck to all of you, to the parents and the kids. And thank you so much, ma'am. Thank you so much, Dr. Charan, for your time.
Thank you.
Bye.
Namaste. Thank you very much. Namaste. Bye-bye.
Namaste. Bye.